Okay, so welcome to today's episode of Molecules to Medicine podcast. For those of you just joining the podcast, we are AI Jules and specialise in helping healthcare and life science companies scale their business and revenue and explore how AI is reshaping industries and accelerating innovation. So if you want to learn more about how we can take your healthcare or life science business to the next level, make sure you stick around. And if you're interested in a free growth consultation, just drop us the word growth in the DMs and we'll get back to you. I'm your host, Jagdeep, and we have a very exciting guest for you today, Jagdeep, CEO of Medicine Drop in the UK. So welcome, Jag.
How you doing, Jagdeep?
Yes, good, thank you.
Good.
So Jag, tell us a bit about your background and journey that led you to Medicine Drop and a pivotal moment or experience that shaped your career to date.
So Medicine Drop, the total journey, I suppose, from my becoming a contractor to actually having Medicine Drop up to date today as it is been about 15 years in total, in truth. So we started off as something called clinical care, and then we merged with another local pharmacy and created Medicine Drop. And it was a bit of a unique proposition in terms of our space. We look specifically after care home patients and all of their medicines around it. So we started off with quite a small area in terms of a scope for looking after medicines, but it meant we could really specialize in what we do. And really, I suppose the pivotal moment was seeing that there was a need within the market for something quite specialist and quite different to what your normal pharmacy experience was. So care facilities and care homes need a total different pharmacy experience to your standard patients, if you like. So they have different needs in terms of recording, different needs in terms of support, training, audit, tools in terms of medication management, as well as supply. So really we saw that as a key differential. And over the last 15 years, we've built experience, tools, toolkits for care homes to then really thrive with their medicines management and really to empower them with a lot of learning and understanding about medicines. So that was kind of the main pivotal moment, I'd say, is identifying that important.
Okay, so how have you seen your role change with those different expectations around it? So let's say in the past decade, you mentioned a few things that have changed and with the industry there. How has your role fitted into that?
Yeah, so the pharmacy itself has undergone a number of changes. When I first started out looking after care homes, they were very much, we had to blister pack medication. A lot of it was by hand as manual tasks. And we had paper prescriptions, and a lot of the data was kind of still in original format, if you like, on paper, on records that weren't accessible. So the shift over the last decade has been, we've gone paperless. So all of our clinical notes, all of our tools, all of our prescriptions, they're all totally paperless. In terms of actual care home needs, they've changed over that period of time as well. They've introduced electronic systems on their end, so EMARs in particular, care planning that's gone on digital formats now. And albeit we, as an industry, are actually quite behind the times in terms of technological evolution. And then in terms of in the pharmacy, there's a whole heap of changes from popping out blisters originally by hand and it taking you minutes for every blister and the potential of getting things incorrect due to human error, to now robotics and blister packing machines and machinery and robotics that really help us streamline processes and make them a lot safer. So above all else, safety has been at the heart of what we do and what we've embraced, whether it's barcode scanning, whether that's automation. And the industry as a whole has embraced it as well, which has made the service to the end user, whether it be a care home patient or a patient in the community, a lot safer for those pharmacies that have embraced it. So yeah.
So the key drive has been towards reducing manual tasks, automation as much as possible, whether it's physical automation as well. Okay. Are there any emerging trends or technologies that you're most excited about in the area?
So for care homes, I think EMARs at the moment are just scratching the surface. So EMARs are electronic MAR charts. They record how and when a medication's been given, kind of like your hospital chart, if you like, that you see at the end of everyone's bed. And I think at the moment the stuff that's out there is greatly improved to what was previously available. However, I do think we're just scratching the surface. I think there's going to be a whole heap of innovation in that space, and there's a whole opportunity for us to really improve it, and improve medication management and interaction management, and actually the patient safety again being at the heart of it. Trying to improve those areas with A, data sets, and B, having easy intervention electronically. So that for me is a really interesting area. And in pharmacy generally, we're moving to a lot more service-based environment. So pharmacists coming out over the next few years now will be prescribers, and they need different interfaces. So they need service-led prescribing, thinking forward interfaces, and they are being developed. Again, I think there'll be a huge amount of development for clinic type spaces and databases and tools for pharmacists as well that will help them reach patients faster and actually interact with patients a lot better.
Okay, great. So you mentioned there patient safety. Are there any developments that you find concerning, or we should approach with cautiously?
Yeah, so patient safety, one of the biggest duresses in pharmacy that it's been under is funding model. So over previous 14 years of the last government, we've had decreased funding. Really, that impacts patients on a very basic level in that businesses can't upgrade and update staff. They have less money to invest in training when funding is held back from healthcare. And ultimately, the end user is the person that gets hit with that. So I do feel like a shift in funding would also help, a shift that would really solidify some of the patient safety changes that have occurred through technological advancement. And what I mean is there's no substitute to a well-trained clinician, technician. Yes, they might be able to operate and look after more patients because of technology, but actually having someone who's really well-trained and who's really invested in, that is super important and key to drivers. So I think on the flip side of that, I think government investment is a really important thing within the healthcare sector, and especially in the UK. So I think that's probably one of the things that's currently probably held us back a little bit in terms of being at the forefront of pharmacy across the world.
Right. So the funding for the correct, highly trained manpower that the front end need to go in line with the technology advances as well. Because every human needs to make the right decisions based on the technology. Okay, very interesting that is.
Yeah, so the pharmacy as a whole, just to give you an idea, has had flat funding for the last, I think, 7 to 10 years. And so that means there's not been any increases. There's actually been a physical decrease. Inflation has been moving a lot faster than any pharmacy funding has. So we're actually regressed in terms of that. So it meant that real decisions have been made by real companies. Large company change like Boots and Lloyd's have exited markets. There's been real life changes, whether you're independent or an upcoming business like ourselves, where we would love to invest in people and skills. But actually, if the funding's not there, it makes life really difficult and tough decisions have to be made.
Yeah, and what impact does that have on patient care?
It's really at the forefront of it because ultimately we want and we need to be able to deliver care to patients in a really sustained manner, in a really cohesive manner, and you can't do that without really well-trained people. So whether that's your pharmacist, whether that's your technician, whether that's your person who's picking up the phone, you've seen yourself, GP's practice appointment times really hard to get hold of. Pharmacies have been hit with the overflow of a lot of that. People have been utilising pharmacy a lot more, and actually, if we have the investment to invest in people, we can actually do a really good job at making sure those patients go to the right places when they need to. However, if that's not there, if we can't upskill our workers, it becomes really difficult to then get those patients to the places they need to fast. So whether that's hospital, whether that's getting them a referral to an appropriate specialist, whether that's getting them in to prescribe them something, we need to have the people at the front end who can identify what the needs are of those populations, and that only comes with training.
So would you say that the burden on the GPs and the NHS is just being passed to the pharmacists? Pharmacy industry now, but it's not really addressing the burden. it's just shifting it to a different place where there's still manpower issues.
There's an element of that, yeah, absolutely. So I think GPs have don't get me wrong, they have a lot of appointments, they have a lot of time taken out, and they have a quite stressful job trying to manage local populations. I think the overspill definitely does end up in pharmacy. Some of that might be by design, and there is an element of, okay, pharmacies can definitely look after more things. So recently we've had something like the Pharmacy First scheme that's come around, which is designed to look after minor ailments and illness. It actually could be a really good pathway for us to be able to prescribe antibiotics without you having to see your GP, or prescribe pain relief or specialist medications. So that is a good scheme in terms of trying to get people in the right places. Unfortunately, part of it is that still we rely on GP referrals for these schemes to work, and we've seen a reluctance in referrals actually, because there's a reluctance of people wanting to refer out, depending on the areas. So weirdly, there's an odd paradigm where GPs are really busy, but equally when they have the chance to refer workloads out, they're not necessarily doing it because they're worried about their future workloads as well, or their future contracts, I suppose. So I do think something has to shift and change, and I think pharmacy is well placed to do it. Has to be in a very structured manner, however. So technology has helped pharmacists get out from behind the counter. That needs to continue. Upskilling definitely needs to help our teams be able to deal with patients better.
Yeah.
And getting patients in front of pharmacists who can prescribe and see them for a range of treatments that traditionally they would have seen a practitioner or a nurse for. It will only add to the NHS's skill sets, but there has to be a willingness of all parties to want to kind of strive towards that.
So there
So
seems to
some of
be a imbalance between the synergy between the NHS different operating arms there, and it doesn't sound like it's very cohesive and communicating very well there, and people are holding back, and maybe there's a lot of red tape, maybe.
awareness is another thing as well.
Awareness.
So yeah, so we have a health centre pharmacy, and we've had to actively kind of campaign with our local practices to say, look,
Yeah.
please send us patients. We've got a clinic, we've got a Pathfinder scheme, we've got a prescriber waiting there. So really to raise that awareness, and obviously patients, once they realise and they've used the scheme once or twice, they will naturally come themselves. But raising those levels of awareness is really important. So yeah, there is a bit of a weird paradox where I think more could be done on the front of channeling people to the right avenues, which again over the last decade has changed greatly. NHS 111 and the advent of referring into different providers has come along in the last decade. I just think that channeling can be done probably smoother and better going forward as well, even
Yeah,
smoother and better.
the NHS is a huge machine, and although it does move slowly, and just because of the size and scale of it, so that's not surprising. But it's good to see that and hear that they are trying to move in the right direction, and they're taking the right positive steps. That's good to hear. And I mean, where do you see the biggest opportunities for innovation or impact within medicine dispensary right now?
So I do believe there's room for us to be able to give out a lot more information and a lot more value to our patients through the use of technology as well. So although we've seen advancements existingly on robotics and automation on the manual stuff, I do believe through software and through us being able to interact with patients in a different manner, whether that's through apps, whether that's through face-to-face or non-face-to-face remote consultations, I think there's a huge amount of value that we can give to populations and actually kind of decrease barriers to entry. So, for example, one of the traditional barriers to entry to pharmacy is, well, if you live local, you kind of have to go to your local pharmacy. And if they're really busy and they can't see you, well, you're stuck in the same place as when you're trying to see your local GP. Well, they're really busy and they can't see me. So with technology, we can break down some of those geo barriers, if you like. And in theory, I do believe you can make advancements where you can see pharmacists online, get consultations, get prescribed what you need to be prescribed, and get it delivered the same day, to kind of like Medicine Drop do. So we deliver the same day to multiple locations. So I think there will be a step change in some of that. And also the quality of information we can give with technology, I think it will be hopefully a lot better. be able to give better consultation notes, better information to the patient to take away, and actual resources rather than just Google, which is what a lot of patients tend to do. So there's an advancement there that can happen in our counselling.
And is that something you can manage locally, or are you dependent on GPs and the NHS?
Yeah, again, some of it will be structures of the NHS. So, okay, right, use this service. Some of it is down to individual businesses saying, okay, right, we've got an opportunity here to help lots of patients across the UK. Models are changing and people are changing. So local services will never go away. You'll still want to physically see someone face to face. But is that appropriate all of the time? So I would argue that actually some of the time patients will be happy enough with a virtual consultation, depending on what their particular need is. And that won't be appropriate for all types of consultations. But yeah, I definitely think there's an arm of work there that could go national quite easily, and you won't really necessarily care if your pharmacist or your prescriber is sat in Milton Keynes and you're sat in Highlands of Scotland somewhere. And as long as you're getting the right advice, the right treatment options, and the medicines when you need them, so that's ultimately the key thing.
Okay. So in terms of Medicine Drop, then, what are your core avenues for the business? That's the fundamental basis of the business.
Yeah, so we do a lot of looking after the medication management of care homes in particular. Class ourselves as specialists in that area because we have done for many years. We've tried to push forward with the boundaries of what they do and try to enhance the offering they get as well. So that will always remain a core business of what we do at Medicine Drop. Looking after care homes and care facilities is core to what we're about, managing complex medication needs, ensuring that patients in groups get their medications when they need them are really important. More recently, we've had a lot of patients individually who also have similar individual needs to care homes and or perhaps on that pathway, unfortunately. So they're moving into more complex medication needs. From being on 1 or 2 tablets a day, they're now on 6 or 7, and they actually need help and assistance with them, whether that's reordering, organising, reminding, or indeed packing them into blister packs, for example. We try and help them all along the way. So our biggest 2 drivers is always going to be looking after care facilities and looking after more complex care patients within their own home. And ultimately, our service is getting them the medicines on time and correctly, and assisting them to get them.
And so what problem is Medicine Drop trying to solve here? And why does it matter to your customers?
Yeah, so that's a really good question. So ultimately, our core and overriding problem that we're always trying to solve is getting medication to people efficiently and accurately. So whether that is a customer based in Great Yarmouth and just needs their blister pack on time, or whether that's a patient who's based in Nottingham and needs their acute medication quickly, our main aim is delivering them to their doorstep and giving patients that convenience and power back over their medications. We're trying to eradicate the need to go on standing queues to try and for an elderly patient to have to get out of the house and have a very tough time trying to get quite simple medications. So our aim is always to help those patients and get them to the person that needs them as quickly and as efficiently and as accurately as possible. And that's what we will, as a core offering, always continue to do.
Sounds great. I mean, do you have any real life examples of a customer that has used Medicine Drop? Maybe a customer or a care home that really, achieved meaningful results for both yourself and the care home or customer?
Yeah, so we have a lot of testimonials on our website and our social media pages, and they're both from care homes and from individual customers. One of my long-standing customers, Mr. Fern, for example, he's on our social media. He's a patient who has chronic obstructive pulmonary disease and has done ever since I've known him. So it's been over 14 years, and he's used our delivery service quite simply because he can't get out. So he's always struggled. He has to take an oxygen tank with him everywhere he goes. So actually having the reassurance that he's got medicines being delivered to him, knowing when they're coming, and knowing that he can pick up the phone and find out anything about that delivery and his next set of medications, knowing there's people on the end who are going to help him out, navigating surgeries and all the other problems that can come about of it, has meant a great deal, and a great deal of quality has improved in his life because of that. Whereas prior to that, he talks about in his testimonial what he used to do, which was this great mission of getting to the pharmacy and then finding out something was wrong and then having to contact the doctor and how stressful that was with the small oxygen tank attached to him all the time. Our key thing is trying to make people as independent as possible, and retaining some of the pleasure and the spending that time doing quality things. That's really important. So we have a lot of care homes as well in the same situations where they were getting services where they were really not getting much for the service, just a delivery of medicines or just things whenever the prescriptions came. And we spend a lot of time organising and helping the care homes, and then giving them a wider picture and making sure that they're ready and prepared for audits, and making sure that medicines management is on point. They unfortunately often work in silos. They're not always a part of a group of care homes. They don't have a lot of other self support. So getting some external agency like specialists like ourselves at Medicine Drop coming in to advise them on how their medicines look in their spaces and what they need to do to improve their medicine management is a massive deal to a lot of our homes.
Okay, great. So reducing that burden and that stress really for patients, about getting the right medication and care so they can just focus on life really, which is really, really good. And what are your biggest challenges or bottlenecks you face at Medicine Drop and medicine supply in the healthcare and medicine dispensary industry? For example, is it patient recruitment or anything to do with data or regulatory compliance or even client acquisition, nursing home acquisitions?
So some of the bottlenecks definitely are around actually medicine supply. So we have systems in place where we will order in medications, but unfortunately due to recent events in terms of things like Brexit and also generally the market, medication supply is quite a tough nut to crack for most pharmacies in the UK. So getting patients on continuity of medicines is really important to us, but actually sourcing them sometimes can be really difficult, because we deal with multiple manufacturers and wholesalers, and sometimes they'll just go totally dry of a certain medication, and we have to then change a patient's regime.
Yeah,
that's one of the challenges. In terms of other challenges the pharmacy or pharmacy industry, I suppose, in general faces, it's trying to keep that continuity of relationship and of our touch points with our customers, I think is really important. So I think as pharmacies in general, we can do better and be more proactive in actually reaching out to patients rather than waiting for them to come to us, which is the traditional model. People come to you or ring you only when they need you. And I think with medicine supply, actually being proactive would really be a massive benefit to the patient and us. Checking in on patients, making sure they're okay, they've got enough supply, verifying if they have any other additional needs. I think that's a challenge that we should step up to as an industry as a whole, to be honest with you.
Okay, so patient outreach on a proactive basis, trying to stay ahead of their needs rather than it being more reactive would really help yourself
definitely.
and the patient. Okay, yeah, so that's interesting. And what makes Medicine Drop different from others trying to solve the same problem?
Why are we different? So yeah, that's a really good question. I think it comes down to care and passion is the honest truth of it. Obviously, there's a level of service that we offer which is not matched out there in terms of we're one of the only pharmacies in the UK that offer blister packs very readily without any cost. We offer same-day service to most of the Midlands, and next-day service to the rest of the UK. But those factors aside, and our specialist nature in care homes, we really care about what we do, and we wouldn't be doing this for 15 years or without wanting to really make an impact on patients. So we're driven by a few factors, and really one of them is the care and innovation in our practice that really makes us different. We're constantly trying to evolve as a pharmacy.
Okay, good. And so what's next for Medicine Drop? How do you see Medicine Drop evolving over the next few years?
So yeah, I mean, we're hoping to help more people, is the honest truth of it. So our aim is always to reach out and help as many people as we can. And over the next few years, we're hopeful that we can invest in technology a lot more ourselves. So some of the software I think we would be looking at would make a real impact in patients' lives, and we're hoping to reach more clients across the UK. So our aim is to be able to be seen and heard in every corner of the UK over the next few years, and be a viable option for patients who need blister packs or care homes who need support. And that's what we will be doing over the next few years. And we have a real passion for making ourselves available to those guys and offering really good solutions to their needs.
So it sounds like you're looking to expand your services and cast your net a lot wider throughout the UK and reach more individual patients as well as businesses and nursing homes, and really trying to boost your awareness and I guess your market presence nationally. And so you are the go-to company for remote access to medicines. Okay.
Exactly that. Really good summary.
Oh, thanks. All right, good. And so looking ahead, what excites you the most about the future of your field?
I think pharmacies, like we said, touched on, is evolving, and with prescribers coming out, I think it's going to be a great opportunity for the sector. And we've existingly got prescribers, and some of my colleagues have been prescribers for many years. But I do feel there will be a shift in the next 5 to 10 years of pharmacists coming out and really being able to impact patients on a clinical level that I never had when I was coming out as a pharmacist. In that we would be able to diagnose, treat, and be proficient at looking after patients individually without having to refer to other parties to do that all the time, and being part of a more of an integrated NHS. So I think that's a huge thing for the sector, and I really hope we rise to the challenge of making sure that that service is integrated and people get access to it at a really good rate. And because we know in the UK we need access to really good diagnostic and prescribing services, and many people are being failed by that currently. So I'm really, really excited for that.
And in your opinion, what's going to drive that change that you didn't see as you were coming out of university, that a new graduate now may have access to certain different tools or networks?
Yeah, so I do think there has to be a shift in the way contracts are organised. So I think that would be the biggest driver. So if I had one wish, if you like, it would be that actually NHS contracts were I suppose, more open to other provision. So whether that's a nurse prescriber, whether that's a pharmacist prescriber, whether it's a GP prescriber. At the moment, we tend to have a traditional model of this is the way prescribing services will work. And I think that probably needs to be looked at again, especially given in the last sort of post-COVID years. I think it's really important touch point now to look at whether that can be changed and whether that can be a bit more innovative in terms of how we deliver services to patients. So I think if there's one core thing, I think it would be NHS contract review in terms of how that can look going forward, and not sticking to the status quo that's always been.
Yeah. Well, that leads nicely into my next question, which was going to be what was the one thing you would change in how the industry operates? It sounds like the contracts would be a huge thing that would help. What excites you the most in the field? You kind of stuck between a rock and a hard place there, almost, aren't you, as well, with the NHS and with new graduates coming through. But there is scope there, to be able to overcome those hurdles. So.
Yeah, I think for the NHS it's really important. I think privately you'll see it happen as well. And so I think we're already seeing that private services are more widely available. I think that will naturally become more accessible, and I think naturally, unfortunately, people will start using them more. Whether that's the right thing, I'm a very big custodian of the NHS, and I think it's a really unique thing for the UK, and we have to really look after it. Yeah. So I think our services should always be available on there, and I wouldn't want like a two-tier system that develops, which is the threat if contractual changes don't take place, I think, is the truth of it. So if contracts don't move in a direction that's going to allow better provision for patients, I think then naturally what happens is that the private services then start to become the alternative provision for patients.
Totally agree about the NHS. It is an amazing organisation, and the work they do, and the super high standards that they work to. They're at the forefront of cutting edge science and technology globally. I've worked with many of the doctors and the scientists that I work within the organisation, and they do a fantastic job. it is unique to this country, which is a nice thing and a proud thing for a lot of British people. So yeah, we do have to look after it as well. It's a very key point you mentioned there, that the users of the NHS have to help look after it where they can, and really, help it, work as efficiently as they can, because many of the people who use it also work in it, so
Yeah.
they understand it, very, very well. So yeah, very good, thanks. And so where is Medicine Drop right now? What stage is the business right now, and what does growth look like over the next 12 months for Medicine Drop and yourself?
I think we're very pragmatic as a business. We're not one of these businesses that wants to grow super fast. We are really pragmatic in that a lot of our services are patient led, and we have patients at the heart of things. So as a company, we do grow. We grow steadily and onward trajectory. And over the next 12 months, we'll continue with that. We have a plan for trying to enhance our offering to all patients over the next 12 months. Currently, we have become one of the largest single site dispensing hubs, not just locally but nationally. So we're within the top 10 now of the UK's single site dispensing hubs, which is a great achievement for us. But we're not people to rest on our laurels. So our endeavours over the next 12 months will see us improve service. And really drill down on trying to offer patients an alternative where they haven't got much choice in the sector. So ensuring that they get the choice that they need for delivered medications and managed medications that really will enhance their personal quality of life. So we'll continue on that journey over the next 12 months, and hopefully be offering some newer products as well at the end of that journey. So some of those will be to help patients support the medication regimes.
Yeah, it's good to hear that you're looking at it pragmatically, and that patient care is at the forefront of everything you do primarily. So it's good to hear that you do hear companies that focus on the bottom line. But
Yeah.
Patient care is the number one priority in healthcare always, and it's good that patients will hear that. Healthcare companies do remember what the patient is all about, because you do hear on the grapevine that people are frustrated with big pharma and things like that sometimes, that that it's all about pushing medicines forward, but ultimately, I mean, everybody in the industry will put patient care at the forefront, but it's good to hear it directly from a company that's nationally in the top 10 providing their service. So that's good to hear. So, I mean, with a pragmatic growth approach, I mean, what channels are you currently working best for you?
So in terms of trying to grow our existing patient and our offering, we do a number of methods of reaching out to patients, both on the whole in terms of trying to use traditional methods like mail shots, but actually a lot of our growth is word of mouth. So usually we try and give really good service and then get feedback and try and push that forward as well. We're looking at exploring avenues to really help that, and testimonials is one of them currently, where we try and get patients to give testimonials so other patients can see what they're going to get into if they decide to join our service. Other ways is social advertising. So in spheres where there's communities around medicines, we will always try and have a presence. So whether that's social media, whether local groups with medication management leads, or whether that's tools that care homes can use, we'll always try and have something there for all of our teams to be part of and be part of those communities.
Okay, good. Yeah. And what's been the toughest part of getting your hands onto your ideal customers?
It's probably fear, I think. So I think traditionally you have a lot of trust in pharmacists and pharmacies. So sometimes switching to a different healthcare provider, whatever it may be, whether it's pharmacy or your chiropractor or your optician, switching out of that model that you're existingly in, I think patients always have a little bit of fear around, okay, right, is this going to be the right choice? What happens if it goes wrong? What do they do? So really trying to break down some of those barriers is really important to us, so that patients can see what the journey looks like. They can understand what it means when they switch over to us, and they can be reassured they have a choice as well. That it's not the be all and end all. They they can always go back to another provider if they need to. So that's probably the most difficult aspect is trying to make sure that patients understand what that journey looks like and let us have a chance at gaining their trust, I suppose.
Yeah, I totally see that. A lot of patients get set in their ways with how things operate and don't like that change. Are not comfortable with that change. And it's not just patients. I mean, lots of walks of life, people fear the unknown. So maybe raising that awareness and finding ways to raise that awareness really push that driver forward. And so are there any other bottlenecks that you're experiencing around the pipeline or your outreach or lead conversion with maybe nursing homes?
I think probably the only other area in terms of care homes is really getting our difficulties is getting our brand and awareness out there. I think is sometimes again care homes look for localized services like they would have traditionally looked for. Well, actually, we've got a pharmacy down the road. A lot of them don't realize that the pharmacy down the road, in truth, is busy with a front counter and probably not really set up to look after care home patients. So they tend to look for more localized services, whereas nowadays that's not really a boundary with 24-hour delivery and systems in place where we dispatch same-day medications. Sometimes just getting past that initial barrier of trying to introduce someone to an idea of someone being in a physical different location as a pharmacy and servicing them that in, I don't know, Gainsborough or Lincolnshire or wherever it may be. It's really important for them to understand actually realistically distance, especially in the UK, because it's a very small place really, relatively.
Yeah.
Doesn't make a huge problem. We can still get meds to patients on a same day basis within a relatively short period of time. So trying to break down that barrier, I think, is probably the biggest bottleneck we have. Again, it's down to understanding and getting in front of people and explaining is probably the toughest thing.
Okay, good. And what are your sort of pressing priorities, say, this quarter?
So this quarter, at the moment, we're working hugely on customer service and processes for our community patients in particular. So although our services and our processes are all set up, as I said, we're pragmatic in our approach. We then look at things as they grow and change and say, okay, right, is this still sufficient for our needs? What does the next 12 months look like in this space? So we're setting that up for the next 12 months. So that means making sure our team's trained well, making sure they can handle multiple queries, making sure they understand processes inside out. So when a patient speaks to them, they get a full picture of exactly what's going on. And then also following through items, testing our systems, auditing them to make sure that actually part and parcel of what we say we're going to deliver, we can deliver. And if we don't end up delivering it in one of our tests or our audits, we can understand what the bottleneck is on our end and the behaviour that needs to change or the process that needs to change as part of it. So we're really going deep into that, and we do a deep dive quite often, and we'll spend a lot of time trying to make sure that those bits are right and really running very smoothly before we then take on further patients.
Okay. And where do you see your biggest opportunity or risk when it comes to scaling your go-to market efforts?
Our biggest opportunity, I think, interestingly, for Medicine Drop, we've always been looking after care homes and care facilities. And I think part of my journey has been realising actually there are a large number of patients now who aren't in the care facilities just yet or are going to them a lot later and actually still need support in between. We've seen domiciliary care rise in the amount of numbers of patients it supports over the last few years. And those patients need people who can offer them medication management support from a trained angle. And unfortunately, sometimes the teams that go in to look after patients in their own homes aren't as skilled as the teams in care facilities. So I think that's a great opportunity for us to help. I think there's a lot of patients there that need support through medication management systems that will make things safer for them. I also think there's a lot of care workers that need support through training and understanding how medicines work and upskilling, and I think we can offer both. So yeah, that's a great.
Yeah, that's a very interesting point. That period of time between before needing a care home, but also now needing care, but you can't get to the care facilities and it's not set up for you. I mean, I've had a similar experience, with a family member, and where they had people coming in to care for them, but I was having to train somebody to be able to learn how to take blood glucose measurements, know how to inject the right amount of insulin, and it's a very, very interesting point you mentioned there, because there is no support there, and a lot of families will have to deal with that themselves, and they're making really important medical decisions actually on their loved ones without actually having any guidance. It's quite a scary thing if you think about it in the general population, because probably 90-80% of people don't know anything about medicines or how to treat somebody. So that's very interesting, and it'd be interesting to see how you develop further in that.
Yeah.
Yeah.
That interface of health and social care is huge, and I think people need help. I think in there, I think that's the truth of it. We really want to provide them with solutions so that they get that support and they get proper support from people who are experts in the field.
And so, Johnny, where can people learn more about Medicine Drop or get in touch with you or your team?
So yeah, our website is normally our primary go-to. So that's www.medicinedrop.co.uk. We're also active on social media and have an Instagram handle of @medicine.drop. And Facebook, naturally, on socials. But any of those sources, if they pop a message down, if they register their interest, they'll normally get a call back, and one of our team will help explain the services to them. So that's the easiest route for them to find out a little bit about what we do and how we can help their loved ones or them.
Okay, great. Thanks for that. And so, it sounds like you've had an incredible journey so far.
In pharmacy and in the healthcare sector, I think that isn't always the case. So I think healthcare sector generally, we've sort of held back a little bit. So I think actually if there was anything, it'd be trying to get the transparency through from my systems into the customer service team so that patients can access their information even quicker than they currently have to.
Okay, so some sort of interface where a patient can log into, maybe see all their information, and that will also be in real time as well. So real time updates and real time information, which will be valuable both for the patient and for yourselves to provide that care and getting that care to the patient as soon as possible. Because I've noticed there is sometimes a delay, although things have moved in recent years with now doctors sending prescriptions directly to pharmacies. There's still a bit of a delay I've noticed there as well. So that probably is something that could be streamlined a bit further. Okay, brilliant. I mean, actually, you mentioned quite a few items during this call today, around that last point there about patient information and that transparency, as well as raising awareness. I'm not sure, and that's something that we specialise in with our clients. I'm not sure if it's a fit right now, but would you be opposed to a 20-30 minute call to dive a little deeper to see if we could potentially help?
Yeah, no, I'd be very interested in seeing if there's anything that from a technological patient point of view can support us.
Okay, brilliant, Johnny. We'll arrange a time for a call after this recording. Any questions for me?
No, I think it's been really interesting having a chat with you today about AI and all the software developments that can help businesses, I suppose. Yeah, so it's been great.
Brilliant. Well, thanks a lot, Johnny. Very insightful that was, and good luck with your business. And I'll set up a call for us to dive a little deeper and talk to you then.
Awesome. Thank you.
Thanks for your time.
Yes. Bye bye.